I love being able to connect with people, I love learning from people, I love the privilege of being able to go in their own environment and to see what makes them them, you know, what's around them, the support network that they've got, and just to be part of, you know, their life experience. Yeah.
I just love working in the community. I work with a very deprived area, so it's good to know that you're putting some input into it and you're getting the feedback from the patients and the family, and you're doing something positive.
Yeah, definitely relationship with parents. Definitely relationship with parents. Yes, babies are lovely, but I enjoy the relationships I have with parents. And in my other role as an educator of health visitors, I think it's kind of promoting a person-centred care and then seeing students go out and actually implement that in practice.
I think you're in a very unique, privileged opportunity to work with families, and you also, because you're working with families for a long period of time, you're getting to see the progress happening. It's not just go in, you fix things and come out. You're working with families for the long haul, so you can see improvements that they've made and see where the steps you've helped the families along the way, and the outcomes of the children are a lot better. So for me, health visiting is certainly a privileged job, but I think it's a great job as well because of that factor.
The main benefits of the universal pathway are that, well, it's patient-centred, that's primarily the most important thing, and also that it will be a shared language for staff to use, and that it's consistent and it's a nationwide approach. And I think as well, the building of the relationships with families, it has a strong emphasis on that.
People could see that the benefits are so vast for families. Outcomes can be improved, we can get to know the families better, we can therefore do assessments which are much more holistic through doing the home visiting and really developing a relationship with the families. So if the families have any problem, hopefully we can just nip that in the bud before it becomes too big a problem. So it's all about early intervention, stopping things becoming too big a problem.
I think the universal pathway's got lots of benefits. I think for families, you get a better relationship with the health visitor. You're able to do those assessments early, so you're able to then target and put in the support that the families need. I think as well you get to know the families really well, and working alongside and with the parents, they get that support and they're looking at certain things within their child health, child development, and they're more likely to then approach us, so they've got more empowerment within that as well.
Again, being able to be out there and be visible and people recognise, you know, that they have a health visitor, who they are, the impact that they can have, and just being able to be there as a resource or to signpost them so that they can achieve what they want to do in life. You know, we all have different ideas of what we want to do, and just being part of that, their experience, you know, is a real privilege, and the pathway will allow us to do that.
We have got an elderly workforce, so quite a few of us are thinking about retirement in the next few years, and so we're having to replace with newly qualified health visitors. Even just getting nurses through the programme is difficult, especially in Shetland. We've got quite a small workforce, so that's difficult. We're just not managing to recruit to the speed that we would like to.
Health visitors feel that they don't ever get to a point where they have more staff to be able to fulfil the role the way that we want to fulfil the role, and health visitors are a really motivated group of people. I train health visitors and I see that they're really dedicated to their role and they really want to fulfil the universal pathway. I think it's important for them to have that framework to follow, and that the universal pathway really does build on that relationship that they will have with the parent and carer.
Challenges at the moment, I think, is around about staffing. That a lot of areas still aren't up to their full complement of health visiting staffing. I think as well time is a big factor, because the IT systems and things like that we've got at the moment aren't quite up to standard, so sometimes you take a long time after you've done a visit to come back and go on the computer and document everything, because the IT system is quite slow and things like that as well, so I think that can be quite a challenge.
Staffing still is a main challenge, particularly in the area that I work in. It won't be the same challenges elsewhere, but I've been really fortunate to do the Queen's Nursing Leadership Programme, and I've been able to learn skills to build up my own resilience and to manage those challenges.
One, just the opportunity to get together with colleagues from across Scotland and hear different perspectives about the implementation of the Universal Pathway. That's been really interesting, and to look at particularly I guess the opportunities that have been offered by the Universal Pathway, which has been excellent. Some of the speakers today, I think even to see Sarah Cowley, it's fantastic, somebody who we have referenced throughout our careers, and she's inspiring to listen to her. She's just got this wealth of knowledge, and I wish I could just transplant her brain into mine.
I think it's good to see health visitors from other areas as well and get their input, particularly for the group discussions, because it was open to other areas, and see what they're doing in their regions. It's great to see the head of the kind of health visiting people to come and see what their thoughts are and what the future is going to be holding for health visiting.
It's been the speakers have been really quite interesting and got a lot out of what's happening, what's coming up, what's the latest things that are happening, certainly with the legislation and things like that. So it's been really quite looking forward to what's happening in the future, which is what I've enjoyed.
I think I've enjoyed talking to other people actually amongst the audience, and also listening to the question time and us having the opportunity to ask lots of questions, and there's been a really positive vibe around the whole conference morning. The group work was really interesting because we all had different things to contribute, and we learned things about each area, you know, that everybody was from, and that was really helpful actually. We could help each other with some answers as well as thinking about the questions.
The marketplace has been fantastic, and really kind of prompting discussion. It's really useful to see the baby box. It was, you know, we're going to be promoting it, or potentially promoting it, and I hadn't seen it before, so to see what's contained in the baby box has been really useful, and actually to ask some questions around the efficacy of it, or the kind of evaluation of that in terms of safe sleeping, etc. has been really interesting and useful.
Networking is always really important to me, and throughout my whole career, just being able to meet with new people, like-minded people, people who think differently, learning, and just getting a flavour of what government are thinking as well, and helps me understand their ideas and makes me think, okay, I'm not sure that they quite get what we do, and there's other areas where I think, yeah, absolutely, they know exactly what we're facing every day in our work. So.
It's been really good networking with other health visitors, really fabulous. Listening to the speakers has been fantastic. They've been really inspirational, so it's been absolutely brilliant.
A lot of the chat during the challenges and opportunities of the new Universal Pathway was their kind of views were about like, oh, we're going to have all these new staff, how are we going to support them, what we're going to do, not going to have any experience. Whereas for me, it's reassuring we're into health visiting at this time, because I feel like we're kind of on an even keel, because we're all starting on something new. So I think going into the team that I'm going into, I've been there for a year, so they're very supportive. So it was a good opportunity to get other people's perspectives. And I got a selfie with Sarah Cowley, who I've referenced to death this year.
The highlight of today.
That has been the highlight of today, yes. So Sir Harry Burns better watch out, because he's next on my list.